Okay, so now we have our model, which just came out of the curing oven with a light layer of cooking spray, which we said is just canola oil and silicone. We have our addition silicone right here in our catalyst and base putty. We're gonna go ahead and mix these together. So we wanna get a nice even consistency by having a nice homogeneous mixture. It helps to kind of roll it between your hands. So now we have something that looks like this. We're gonna roll it out into a rope, take a little piece off to test, place it over top of our teeth, like so, form it around the teeth, and we wanna go a little bit towards the posterior, maybe covering up a little bit of the molars, just so that way we have a nice positive seat over top of the teeth. Now this is often an issue when I'm showing people how to make this. They don't know how to make it look nice and smooth. So one quick tip to make it smooth is to grab just regular old hand soap. And that surfactant quality in the hand soap will actually help us out quite a bit. It's going to allow us to kind of push down with our finger and make this putty matrix nice and smooth and get rid of some of our fingerprints from the putty matrix. Which is what I'm doing right here. Do the same thing on the lingual. Use that soap to really start to smooth out our putty. And set it down like this. And because we've soaped it and we have a glass slab, we should have a really nice, smooth, even surface. Just a little bit more here in the lingual. Take this right across the buckle. And now you can see a really nice, uniform, smooth horseshoe design. I'll do the same thing here just to smooth this putty out. Taking our gloved finger and really starting to work the putty to get it nice and smooth. And to me, this is just style points for our patient, showing that we kind of took the time and we didn't make some kind of cruddy looking putty. Now, I'm using this extra piece here. I'm not necessarily making a ball out of it. You can if you want to. Make that the world's most expensive bouncy ball. But what I'm gonna actually use this for is to test to make sure that it's completely set. So as I'm shaping this and getting it nice and smooth, occasionally I'm gonna be coming back here and kind of poking with my finger. Now what I'm trying to use is my fingernail, poke into the ball, and you can see it still leaves an indentation. As it starts to set, we poke our fingernail in there. If you forgot what your timer looks like, you can kind of test the rebound effect by using your fingernail and making sure that that putty is completely 100% set. Now, everything's looking good on this model so far. I actually want to let this set because I'm going to do a complete putty reline. Doesn't matter if the pieces don't 100% adhere to each other because we're going to have complete overlap with that putty wash. It's not like an impression where I'm worried about having it in a partial set state. I don't mind if it's completely 100% set. Now, we're going to come over here. You can start to see it starting to rebound a little bit more for me, but we're still not 100% there. Overall, everything's starting to look really good. Now, the one thing I want to have out is a nice, clean 25 blade. And we're going to use this to do some of our trimming even as this model is setting still. So we're going to come in like so, and start to trim back. Some of our putty. Trim, really nice smooth surface. Check our rebound here. And now it's fully rebounding. When I take my finger, we're not making any sort of rebound whatsoever. So we'll pop this putty matrix off. You can see the really nice representation we got of the teeth. I'm gonna make one little notch at our midline, so that way we can see where our midline is going to be. We're going to come posterior by the molars. We're just going to go ahead and cut that off since we don't really need that. And now we're going to go onto the palate and remove just a little bit of this excess palatal tissue that looks like it's maybe under supported. Still important we leave some of the palate intact, because that's going to help us as almost a primary support area when we go to seat this in the patient's mouth. And now I'm going to come back here, cut off a portion of this molar where it doesn't look well formed. And overall, we have a pretty nice model so far. Now the next thing we're going to do is we're going to put our model back on here, putty matrix back on. We're going to use an Aquasil extra light body wash, and we're going to fill up this entire area and seat this. There we go. Back onto the model. All right. And I don't care if I have a ton of excess. Again, we're going to trim it. So move this off to the side. I'm going to go ahead, find our midline, line up our midline, and ever so slightly, we're going to seat this putty matrix. Now, we're going to let some of that ooze out, not a huge deal. And I'm going to set it just like so. The worst time to try to clean up a light body or extra light body putty is while it's still setting. So I'm not going to sit there and mess with it, but I'm going to change my gloves out here. Flip this around. And now you can kind of see what we're starting to work with. We'll take a little bit more of our soap, get some soap on our gloves. So that way we don't have a lot of this putty or this light body sticking to our gloves. I'm going to go around the edges. And ever so lightly start to form up and make it just a little bit more neat. Same thing here. Same thing here. A little bit more soap. Okay. Again, this is just a way to make it look smooth, make it look nice, and try to remove any excess off of here. Go on the lingual, do the same thing. like so, just like so, just like so. Now our light body, or extra light body, is still setting. So as it's setting, I'm just going to take my thumb, kind of clean up any of the stuff that's sitting on the external surface. Make this look nice and smooth. Take a little more soap. Really start to get this nice and clean. Okay, pretty good. Last step is we'll take a paper towel and kind of clean off the excess. Again, I'm doing this just so it looks nice and neat. There's not a bunch of multicolored stuff stuck all over my putty. If you don't care about that, well, you can skip this step. All right, so overall, I'm pretty happy with the appearance of this. Okay, now we're gonna take a look. The putty is starting to set really nicely. We're getting some nice rebound to my fingertips. So, pick all this stuff up. We'll start to separate this from my model. Now, if you look inside, we have a really nice light body wash internally, which is going to make a really nice fitting restoration around my patient's tissue. Now again, we're going to take this knife and we're going to start to cut some of the excess material out that we don't need. Especially back here in the molar area. There we go. Now we'll go back into our midline, which we already have marked. We can trim it. And if we're having a hard time cutting this with our blade, we can grab some sharp scissors and cut a little bit of the roof of the mouth off this. But overall, I now have a putty matrix, nicely lined. That we plan to take, put back on the model, and we have ready for our patient tomorrow.